Well, the current pandemic has upended so many aspects of everyday life, but for many people considering pregnancy or already pregnant, those changes can feel even more overwhelming. Health expert and genetic counselor Julia Wilkinson is here with more. Thank you so much for joining us.
Thanks for having me.
Happy to have you here. So, what can people do while they're at home just to be more proactive and to prepare?
I get this all the time from my patients right now who are at home and are not sure about what all those next steps can be, or they might be a little anxious about what those next steps should be. So I've come up with a list of a few things that you can do right now from home to prepare, but also to stay safe. The first thing that we want you to do is to do some research. This means asking questions about your family history and your partner's family history to see if there's anything in there that you might be concerned about for your health or for the health of your future child. It's also important, if you're not yet pregnant, to start tracking your monthly cycles. There's different apps that can help you to track this, but it's important information to be able to provide to your doctor's office. It's also important while you're at it to go ahead and gather and organize your medical records, especially if you've seen different physicians over the last few years. Getting everything into one place can really help. It's also important to keep in mind what vaccinations you might have had. Sometimes that vaccine information is back in your pediatric records, not in your adult records. So it's important to go ahead and do some digging now so that everything is at your doctor's fingertips. And then, as a genetic counselor, one of the things that I think is the most important that you can do is to make sure that you're getting your genetic carrier screening. And companies like Invitae are making it really easy to do that from home as well. So you can do a little bit of research, a little bit of homework, get some testing done, and have all that information ready for your next appointment with your doctor, whether or not that's in person or via telehealth.
And what tests are available to better understand the health of a pregnancy?
There's some tests like ultrasounds that you would need to do during a pregnancy in the office. Can't do that over telehealth. But there's others like your carrier screening that can be done right from home. So this is a simple saliva test. A kit gets mailed to your house, and then you send it right back into the lab to get your results. This testing helps us to assess the risk for you and your partner to have a child who may be affected with one of the genetic conditions that are being tested. And having this testing then allows us to think about, are there additional tests, precautions, or preparations that need to be made because of the information that we found?
So it sounds like testing is an important step to take before pregnancy, but can we take genetic testing during pregnancy as well?
Yes, the earlier that we take the testing, the better, because then we can have these conversations earlier as well and really have all of those different options available to you. But it's important to take it at any point, because then we can know, again, are there things that we need to be doing to prepare for delivery once you're already pregnant as well?
And where should we go for more information?
More information can be found at Invitae's website, invitae.com. There's some great patient resources, some educational videos, and lots more information about the testing that's available.
Okay, mvt.com. Julia Wilkinson, thank you so much for being with us. And we'll be right back with more Midday Maryland right after this. Stay tuned.